Today's topic of discussion is inguinal canal and spermatic cord. So, okay, we learn about inguinal canal and spermatic cord. Initially, we discussed about inguinal region and femoral region, right? So, talking about inguinal canal. Now, what is inguinal canal? As you can see right here, right, this structure. Okay, as you can see right here, this is our inguinal canal. What is this? This is our inguinal canal. As you can see right here, right, this passes, this is what, this is our inguinal canal. Now, what is inguinal canal? If you look the position of inguinal canal, then you will find that it is obliquely placed. So it is oblique. What I'm saying is it is oblique intramuscular structure. Intramuscular structure. Why I'm saying it intramuscular structure? Because there are many structures that are beneath it and above it. So intramuscular structure, and it is what? It is found in what? It is found in lower part of anterior abdominal wall. Where? Lower part of anterior abdominal region, right? Region. Okay. Now talking about its extension, it is extended from what? It is extended from our this structure. What is this structure? This is deep inguinal ring, and another structure superficial inguinal ring. So talking about its extension, it extends from deep inguinal ring to superficial inguinal ring. So this was about what? Brief discussion about inguinal canal. Okay, what I said right now is it is what? Obliquely placed. It is obliquely placed intramuscular structure found in the lower part of anterior abdominal region, right? And talking about its extent, it extends from deep inguinal ring to superficial inguinal ring, right? Superficial inguinal ring. So right here, if you just focus, you will see one structure and this structure, right? This structure is inguinal ligament. We have discussed earlier also. Inguinal ligament, it will be attached to what? This is what this is anterior superior iliac spine, right? This is anterior superior iliac spine, and here the point where it will the point where this our inguinal ligament will go and be attached is another point is what? Pubic tubercle, right? Pubic tubercle. So that is the extension of what? Inguinal ligament, right? Okay. Now talking about now we'll be discussing the different boundaries of inguinal ligament. Anteriorly, which muscle will contribute anteriorly, which will contribute posteriorly, on the roof, on the floor. We'll be talking about that thing so well. So right now the thing that we will be discussing is we will move into that section, right? And then we'll come back again to this diagram. We'll move to this section. So if you know as you can see, this is the diagram of what? This is the diagram in which we are watching what? External oblique muscle. So if you remember the order, what was there? There was external, what was there? There was external oblique muscle. Inside there was internal oblique muscle, and inner to internal oblique muscle, what we were having? Transverse abdominis muscle. Inner to that we were having what? We were having transverse fascia, right? Transverse fascia, and then inner posteriorly we are having peritoneum. So right now what we are looking right here is this is what? This is our anterior superior iliac spine, right? And this structure as you can see right here, right? What is this? This is inguinal ligament. What is this? Inguinal ligament, right? Inguinal ligament. Now here as you can see, these are what? These are external oblique muscle. Now what these external oblique muscle are doing is these external oblique muscle are giving rise to its aponeurosis. That means external oblique aponeurosis. Now these external oblique, what they are doing is, as you can see right here, right, this spermatic cord, right? Spermatic cord is the what? It is the extension of what? Here you can inside you can see what you will find inguinal canal. So as you can see, the external oblique muscle is above, right, above the inguinal canal. This external oblique muscle, what it will do is it will form the anterior wall of our inguinal canal, right, anterior wall. So right now we'll just keep it simple. This is external oblique muscle, it is forming the anterior wall. In this diagram we will find what, inguinal ligament. Here you will see, then you will find what, femoral artery also. It is present on what, mid inguinal point. What is mid inguinal point? Point between what, anterior superior iliac spine to pubic symphysis, different from what, mid inguinal ligamental point. That's all. So here you can see what, pubic tubercle. You can see pubic tubercle right here. You can see ilio-inguinal nerve, just leave it right now. You can see pubic symphysis, right. Superficial inguinal ring is present right here, right. The extension of inguinal canal, it is from what, deep inguinal ring to superficial inguinal ring, right. It is linea alba. If you have watched the lecture of surface landmark of our this abdomen, then you would have idea about linea alba. So now what we are doing is we are removing this layer. Now when we remove this external oblique muscle, what will be there? There will be internal oblique muscle. Now let us talk about internal oblique muscle, right. Internal oblique muscle. Talking about internal oblique muscle, the thing that you will find here is this internal oblique muscle. What it is doing is, it is the same story, anterior superior iliac spine, right. Here it is pubic crest, right, and this is what, inguinal ligament. So the same story. Okay, the thing here is, this is what, this is internal oblique muscle. What, internal oblique muscle. And this internal oblique muscle, what it is doing is, it is producing is, it's what, aponeurosis, and here we have the aponeurosis of internal oblique muscle. Now what is going on here is, as you can see these here, the structure, some of the structure, it is again inside, right. It is again inside inner beneath to internal oblique muscle. So here some of the structure are inside of internal oblique muscle of what, inguinal canal. So here what is going on is, this internal oblique muscle, as you can see, it is forming what, this internal oblique muscle, as you can see right here, this internal oblique muscle is forming what, the anterior wall. As you can see, it is forming anterior wall. It is forming what, anterior wall. Anterior wall. Now all the thing that we are talking is, we are talking about the wall and boundaries of what, inguinal canal. So here internal oblique muscle is forming anterior wall of inguinal canal. Similarly, as you can see, it is its aponeurosis, it is just extending in this area also. In this area also, what it is doing here, it is forming the roof. As you can see, this is forming roof. It is also forming roof of inguinal canal. Similarly, if you just concentrate right here, you can see that here you can see this is going behind, right. It is going behind. That means it is also forming what, it is also forming our posterior wall. What it is doing, it is forming posterior wall. Posterior wall. So internal oblique muscle, what it is doing, internal oblique muscle, right. Internal oblique muscle, what it is doing, it is forming what, it is forming anterior wall, it is also forming roof, it is also forming what, posterior wall, right. Okay, now let us remove this internal oblique muscle. When we remove internal oblique muscle, what will be there? There will be what, transverse abdominis muscle, right. Transversus muscle or transversus abdominis muscle. Now if you see, right, if you see, what is this? This is our deep inguinal ring, right. And here you will obviously you will find what, superficial inguinal ring, but it is not being seen right here. Here the thing that you will see is, this transversus muscle, it is unable to form the anterior wall because it is so lateral. You can see it is so lateral to these what, inguinal canal. So it is not able to form what, these our transversus muscle will not be able to form anterior wall. Okay, what about its roof and posterior wall? Talking about its roof and posterior wall, you can see, right, you can see right here, you can see roof, it is forming roof, and you can see right here it is also forming what, the posterior wall. It is going behind, so it will contribute to what, it will contribute to roof and it will contribute to posterior wall, right. Now if you just concentrate right here, then you will see the conjoined tendon, right. What you will see is conjoined tendon. What is the meaning of conjoined? Conjoined means by the combination of two. Now how this conjoined tendon is being formed? This conjoined tendon is being formed by two posterior structures or the structures that are found in posterior wall. Okay, what are the structures found in posterior wall? Was there external oblique muscle in posterior wall? No, it was not there. Was there internal oblique muscle in posterior wall? Yes, it was there, right? We said posteriorly, it will go posteriorly and it will form. Okay, one is internal oblique muscle and another is, okay, internal oblique muscle, and another thing that was going posteriorly till now is transverse abdominis muscle. So conjoined tendon is formed by transverse abdominis muscle and what? Internal oblique muscle. So okay, as you can see right here, it is what? Deep inguinal ring, right? Deep inguinal ring. Okay, and other thing that we are going to discuss right here is, no, we are not going to discuss anything right here. Okay, now let us move toward another, when we will be removing transversus muscles. Now when we will remove transversus muscles, there will be what? Fascia transversalis. Now here fascia transversalis, talking about fascia transversalis, the thing that we need to know is here you will see what? You will see deep inguinal ring, right? Okay, deep inguinal ring. Okay, this deep inguinal ring, it is because of the defect in fascia transversalis. I mean, fascia transversalis was running continuously, it was continuous, but in one point there will be what? There will be its defect, right? There will be its defect, there will be its opening, or we can say anything, right? Breach, and that point is known as what? That point is known as our what? Deep inguinal ring. Deep inguinal ring, right? You can see right here, deep inguinal ring. So what is deep inguinal ring? Talking about deep inguinal ring, it is the defect in what? Fascia transversalis. Fascia transversalis, one important point. Now talking about other thing right here is, we need to talk about what? Okay, since we know this is what? This is femoral artery at what? Mid inguinal point, right? Now above it we have what? Mid inguinal point. Now above it what we have is, we have inferior epigastric artery. Now why this inferior epigastric artery important? Because this inferior epigastric artery will go to what? Go to rectus sheath. It will go to rectus sheath. Now it is going to rectus sheath. Now what is this inferior epigastric artery actually? This inferior epigastric artery is actually a branch of what? It is the branch of external iliac artery. What I said is branch of external iliac artery, right? It is a branch of external iliac artery. Now another thing that we are going to discuss here is now this inferior epigastric artery, where it is present? It is present in the medial wall of deep inguinal ring. As you can see, this is our deep inguinal ring, right? And this inferior epigastric artery is present where? It is present on the medial. As you can know that this is what? This is the region of pubic symphysis, right? And this is the medial midpoint of body. So now what is this inferior epigastric artery? It is present medial to what? Deep inguinal ring. So talking about now here, the point of discussion is, right? Now what will happen is, if because of some reason hernia will happen, and that hernia will arise, or hernia will arise lateral to these vessels. What we are talking about? These vessels, right? Lateral to these vessels. If hernia will arise lateral to these vessels, as you know, this is the midpoint, so this is the medial side, and we are talking about the hernia. If hernia arise laterally to these vessels, then that hernia is called what? That will be called indirect hernia. We have discussed a little bit about indirect hernia earlier. What I am saying is, this will be called what? Indirect hernia. What I am saying, if it comes laterally, right? If the content will come laterally to these vessels, then it will be called what? Indirect hernia. We have said these are more common in young males and so least common in females. Okay, now what if the hernia come from medially? If the hernia comes from medially, then it is called what? It is called direct hernia. Medially it is called direct hernia. Okay, direct hernia. So right now, okay, another important thing, okay, we talked about what deep inguinal ring. We talked about deep inguinal ring. It is what it is due to this due to what breach or discontinuation in fascia transversalis. Now talking about that, what about superficial inguinal ring? Superficial inguinal ring is somewhere present right here, right? Now what about superficial inguinal ring? I forgot to mention, but superficial inguinal ring, it is due to discontinuation or it arises in what? External oblique muscle, as we have discussed here. External oblique muscle, external oblique muscle. Okay, so this was all about what? This was all about different, I mean, external oblique muscle, what it is doing, right? What this internal oblique muscle is doing in perspective of inguinal canal, what this transversus abdominis is doing, what this fascia transversalis is doing. So this was all about. Okay, now to now what we'll do is we'll keep each and everything in one diagram. So what we are doing is, here we studied separately. We studied external oblique muscle, we studied internal oblique, we studied separately. Now what we'll do is we'll keep all these things togetherly in one diagram, and this is the diagram. So now we'll again study the same thing and we'll be clear through different perspective. So the first thing that we need to know right here is, the first thing that I'll highlight right here is, I'll highlight peritoneum. Now what is this peritoneum? Peritoneum is the most posterior thing, right? The most posterior thing. Now, and what are the anterior to these? The anterior to these are transversus fascia, transversalis fascia, right? Transversus abdominal muscle, internal oblique muscle, external oblique muscle, right? These are. So earlier we mentioned order: external oblique muscle, internal oblique muscle, right? Transversus abdominis muscle, transversus fascia. Another word, what we talked about peritoneum. So same. Peritoneum we have mentioned right here, transverse abdominis, transversalis fascia we have mentioned right here, right? Transversalis fascia we have mentioned right here, transversal abdominal muscle is right here, internal oblique muscle is right here, external oblique muscle is right here. So the first thing is the most posterior one thing. What are the most posterior one thing? These are the peritoneum, posterior things, right? Okay, now moving a bit anterior. A bit anterior we will find what? Transversalis fascia. If you remember the discussion, transversalis fascia, the last one figure, this figure, what we talked here, right? Transversalis fascia, what it was doing here is it was contributing to form what? It was contributing to form deep inguinal site, deep inguinal ring, transversalis fascia, right? Defecting transversalis fascia. Yes, we talked right here, we talked right here. Deep inguinal ring is because of discontinuation or because of defect in fascia transversalis and transversalis fascia. It is same thing. So here the point is transversalis fascia will contribute in formation of what? Deep inguinal ring. Okay, now here one important point is written right here, and the important point is deep inguinal ring is the site of protrusion of indirect hernia. If you remember direct and indirect hernia, we discussed right here. Indirect hernia, what we were saying is indirect hernia are the hernias in which the hernia appeared, or the material of hernia appeared from where? Laterally. From where they are arising? They are arising laterally, from laterally. So these are the vessels. So laterally, that means deep inguinal ring is the site for what? It is the site for what? Indirect hernia, since deep inguinal ring is also present laterally to these vessels. That's all. So it is the important point right here, right? Okay, now moving forward, what we have is we have transversus abdominis muscles. If you remember transversus abdominis muscle, it was present so laterally that it was not contributing to anterior wall. Now what it was doing? It was contributing to roof and what? It was contributing to roof and posterior wall. Okay, we are talking about what? Transversus abdominis muscle. This diagram, which one? Transversus abdominis muscle, right? It is written just transversus muscle, but it is same thing. So what it was doing? It was not forming anterior wall, as you can see right here. This was so lateral. What? This was so lateral that it was not contributing to anterior wall, but it was contributing to what? It was contributing to roof on this area, and it was contributing to posterior wall. So that was all about what? Transversus muscle. Now moving forward, another thing is anterior to transversus abdominis muscle, we have internal oblique muscle. Now what internal oblique muscle was doing? It was forming each and everything, anterior wall, it was forming posterior wall, it was forming roof too, right? Roof, anterior wall and posterior wall, it was forming everything, as you can see. Okay, this is our what? This is our internal oblique muscle. Now as we have discussed, the posterior structure of internal oblique muscles, aponeurosis and transversus abdominis muscles, what they were doing? They were conjointing and they were forming what? They were forming conjoined tendon, as you can see here, right? We discussed it where? We discussed it here. So this was conjoined tendon. Now talking about what? External oblique muscle. What external oblique muscle was doing? The external oblique muscle was providing what? Anterior wall, right? Anterior wall. Another structure was the discontinuation in external oblique muscle was giving rise to superficial inguinal ring, if you remember, right? Superficial inguinal ring. Here you can see this is what? This is our superficial inguinal ring. It is being formed by what? External oblique muscle. Similarly, this one, this is what? Deep inguinal ring. Now okay, now other thing that we will be discussing here is, okay, since we talked about what? We talked about indirect hernia. Now what about direct hernia? These are the vessels, if you remember, vessels. We said that if hernias arise laterally to these vessels, these arise from lateral region to these vessels, then that were called as indirect hernia. And if the hernia arise or the hernia arise from medial, then it will be called as what? Direct hernia, as you can see right here. Direct hernia, site of protrusion of anterior abdominal wall, the site of protrusion of direct hernia. That's all. Now there are two things, just 2 points that we need to know, and the 2 points are the about ligament. These two are the ligament. If you see, this is medial umbilical ligament, and talking about medial umbilical ligament, it is the obliterated umbilical artery. What I said is, this is medial umbilical ligament is what this is? This is obliterated what? Umbilical artery. That's all. This is medial and this is median. Just concentrate on words, medial and median. Now what about this median umbilical ligament? I'm talking about medial umbilical ligament. It is the remnant of what? Allantois. And this allantois umbilical artery we will be discussing in what? These things we will be discussing in umbilical we'll be discussing in the topic of umbilical and its anomalies, right dear? Okay, now another, there are two muscles right here. You can see rectus abdominis muscle, right, and pyramidalis muscle. Now the important point about these two muscles is both of them are covered by what? Rectus sheath, right, rectus sheath. Now talking about pyramidal muscle, you can see right here, this is what? This is what? This is our pyramidalis muscle, right? Pyramidalis muscle. And talking about pyramidalis muscle, what is this? Pyramidalis muscle is a small muscle near pubis. Small muscle, it is a small muscle near pubis. And there was one important question from this pyramidalis muscle. It is supplied by T-tubal knob. It is supplied by T-tubal knob. And what is this T-tubal knob called? It is what? Subcostal knob. Right, subcostal knob. Now as you can see, what is this? Spermatic chord, right? Spermatic chord, the continuation of what? Inguinal canal. This is our spermatic chord. And and here if you remember the lecture in which we talked about what? Anterior, in which we were talking about anterior abdominal wall. At that time we were also discussing about descent of testis into scrotum. At that time the different different component of anterior abdominal wall, how they are contributing to different structures on scrotum. At that time we discussed the different layers on scrotum, different layers that are surrounding testes. So at that time this it goes similar to that concept. I mean, at that time what was going on is transversalis fascia was forming what? Internal spermatic fascia, right? Internal spermatic fascia. Similarly, internal oblique muscle, what it was doing, it was forming cremaster muscles and fascia. Similarly, external oblique muscle was forming what? External spermatic fascia. So same goes for what? Same goes for spermatic cord. No difference at all. So in this diagram we combined each and everything that we discussed, and we just studied about different thing. Similarly, what we began with peritoneum. As you can see, the peritoneum, the most posterior thing, and then anterior is transversalis fascia. What was transversalis fascia contributing? It was contributing what? Deep inguinal ring. Deep inguinal ring was also the site of hernia. Similarly, another is transversus abdominis. Transversus abdominis, what it was doing? Transversus abdominis muscle was not forming the anterior wall, it was just forming the posterior and the roof. And similarly, internal oblique muscle, what it was doing? It was forming each and everything: anterior wall, posterior wall, and your roof also. And what these two muscles were doing? These two muscles, they were forming conjoined tendon, right? And again, more anterior to them we had what? External oblique muscle. What external oblique muscle was doing? External oblique muscle was contributing to anterior wall. And similarly, the discontinuation in external oblique muscle was what? It was giving rise to superficial inguinal ring. And another thing that we discussed is we discussed about the indirect hernia, direct hernia right here, right, medially to these vessels, right? Similarly, we talked about medial umbilical ligament and median umbilical ligament. Medial, that medial umbilical ligament is a remnant of umbilical artery. Median umbilical ligament, it is the what? Remnant of allantois. Similarly, we talked about two muscles which are being covered by rectus sheath. The pyramidal muscle is the small muscle that is supplied by T12 nerve, that is subcostal nerve. Similarly, we talked about spermatic cord, the different covering of spermatic cord, and we said that these covering are similar to what? Scrotum, the covering of testes. So this was what? This was the overall review. Now we'll proceed forward. Now so now we were watching the transverse section of what? Transverse section, in which we will see what? Spermatic cord. Right here you can see this is the spermatic cord. Now here in this diagram we can see this number 1, right? Number 1, as you can see right here, this is what? External oblique aponeurosis. Now external oblique aponeurosis. Now talking about external, now after external oblique aponeurosis, right, this is what? External oblique aponeurosis. Let me write external oblique aponeurosis. The inner one is external oblique aponeurosis, and outer one, what we will see is, we will see here inguinal ligament. Now similarly, inner to this number 2, what is number 2 structure? Inner to this number 2 structure, this is internal oblique muscle. What is this? Internal oblique muscle, right? You can see right here, internal oblique muscle, it is forming what? It is forming what? It is forming roof. You can see right here in this diagram, right? Another thing that we will be talking about is, we'll be talking about the third one structure, and this third one structure, what is this? This is transversus abdominis muscle. Simple, transversus abdominis muscle. Similarly, figure number 4, as you can see right here, figure number 4, the fourth one structure right here in the diagram. What is this? The fourth one structure is transversalis fascia. Transversalis fascia, right? What transversalis fascia is doing right here is, it is forming the posterior wall. Now okay, right, now this is what? This is transversalis fascia, right? It is forming what? Posterior wall, and also the roof. You can see right here, it is forming somewhat, it is forming roof also, roof and posterior wall. So now if we just focus in this chart, then we can see right here the anterior wall. What are the things that are contributing to anterior wall? External oblique muscle, external oblique aponeurosis. We talked earlier that external oblique aponeurosis, what it is doing? It is contributing to anterior wall, right? And another structure that it was contributing was, it was giving rise to what? Our deep inguinal ring. That's all. Now another thing, and that is the roof. Roof is being formed by internal oblique muscle. You remember internal oblique muscle, and transversus abdominis, right? Transversus abdominis. Okay, and these two things, what they were doing, they were forming what? Conjoined tendon, if you remember. Now posterior wall, what are the things that are contributing to posterior wall? The things that are contributing to posterior wall are transversus fascialis and parietal peritoneum, right? Parietal peritoneum, which is outer to this 5 number structure. Okay, and floor. Now what are forming floor? The floor are being formed by inguinal ligament. And you know inguinal ligament, okay, inguinal ligament is in fact it is the modification of external oblique aponeurosis, external oblique aponeurosis. So we can see this external oblique, right? External oblique is contributing to what? Anterior wall and also to roof, also to floor, because the modification of external oblique is itself what? It is inguinal ligament. So that's all. Inguinal ligament is forming the floor, right? Densely interwoven fiber of lower external oblique aponeurosis and adjacent fascia lata of thigh. Okay, it is mentioned right here. What is inguinal ligament? It is densely interwoven fiber of lower external oblique aponeurosis. So I said that we can say external oblique is forming what? Anterior and floor, both things. So, and another thing is the adjacent fascia lata of thigh also contribute to what? The floor. So this was what? This was about our diagrams. Now let us draw one simple diagram in which we will cover each and everything. So the first thing is deep inguinal ring. What is deep inguinal ring? It is because of what? It is because of defect in external oblique muscle, right? Okay, deep inguinal ring is right here, and here we have superficial inguinal ring, and this is structure what we are talking all about is what? Inguinal canal, right? Talking about inguinal canal. Now right here we can see the exterior, right here the first thing that we see is external oblique muscle. You can see external oblique muscle, as I have mentioned earlier. This external oblique muscle, the breach in external oblique muscle or the discontinuation in external oblique muscle is what? Superficial inguinal ring. That's all, right? You can see right here. Similarly, deep inguinal ring. What is deep inguinal ring? Deep inguinal ring is deep inguinal ring results because of what? Because of discontinuation in fascia transversalis. You can see right here. Okay, that's all. Now other thing, since we talked about external oblique muscle, let us talk about internal oblique muscle. Internal oblique muscle, you can see right here what internal oblique muscle is doing. It is forming anterior wall, posterior wall and roof. That's all. Now moving inward, what we can see right here is, now after internal oblique muscle, what we have got is, we have got transversalis abdominis muscle. Now what transversalis abdominis muscle is doing? Transversalis abdominis muscle is not contributing to anterior wall because it is present so lateral. It is contributing to what? It is contributing to our what? It is what we are talking about, transversalis abdominis muscle. So it is not contributing to our what? It is not contributing to our anterior wall. It is contributing to our posterior, roof, right? Roof. It is contributing to roof. So now talking about another thing, conjoined tendon. Conjoined tendon because of what? Transversalis abdominis muscle, and another is internal oblique muscle. That's all. And it is the reflected part of inguinal ligament. We are not going to talk about this one right now. So this was the diagram about what? Diagram about our different boundaries, right? So we left one diagram earlier, okay, right here. Okay, now you can see right here these things we just discussed right now. Okay, upper one, roof, lateral, medial and floor, right? Right here, what is this? This is our what? Inguinal canal, right? This is our inguinal canal. This is what? Deep inguinal ring. Because of what? Deep inguinal ring. Because of what? Deep inguinal ring because of discontinuation in fascia transversalis. Similarly, superficial inguinal ring, right? And this is because of what? This is because of external oblique discontinuation in external oblique aponeurosis, right? Now inner to what? Inner to external oblique we have what? Internal oblique. We can see right here. Inner to that we have what? We have transversalis abdominis. It is not shown right here. So these two, internal oblique and transversalis abdominis muscles, what they were doing? They were forming a tendon that was conjoined tendon, right? So these structures, these are contributing to posterior wall. You know, fascia transversalis, conjoined tendon, reflected part of inguinal ligament, these are contributing to posterior wall. Similarly, anterior wall are being formed by internal oblique, external oblique, right? Okay, now this was about that diagram. So now the last thing that we need to discuss is, we need to discuss about spermatic cord. Now talking about spermatic cord, right, we need to know, okay, right now what we are doing is we are taking out this picture, right? We just picked it up and we just magnified it and we just pasted it right here. So we need to know about the different covering of spermatic cord, and we need to know about the different content of spermatic cord. And now knowing about the covering of spermatic cord, so the first thing that we need to know is the outermost covering, right? The most superficial or outermost covering is external spermatic fascia. And if you remember, this thing, external spermatic fascia, it was contributed by what? It was contributed by external oblique muscle, right? External oblique muscle of abdomen was forming external spermatic fascia in testis and scrotum. Similarly, this is the outermost, most superficial one, and inner to that we have cremasteric fascia, and cremasteric fascia was formed by what? It was formed by internal oblique muscle, right? It was formed by internal oblique muscle. Similarly, internal spermatic fascia was formed by transversalis fascia. What I said is transversalis fascia. Now, and we have discussed that transversalis abdominis muscle will not contribute to what? These things. So, okay, these were the covering of spermatic cord. Okay, these were the covering of spermatic cord. Now, talking about the content, right? The first thing that we will be talking is, we'll be talking about testicular artery, right? Here in the center, testicular artery, right? Testicular artery. And around this testicular artery we'll find what? We'll find different, right? Different veins, right? And these vein forms what? These vein forms plexus. So we call this pampiniform plexus, and these are found around testicular artery. What I said is pampiniform plexus, and these are found around testis, and these are pampiniform plexus of what? Of vein. These are the plexus of vein. So this is what? Artery and veins, right? And here you can see there are sympathetic nerve right here in the center, right? And another important thing that we need to know right here is, as you can see, there is ductus deferens, right? Ductus deferens, what? It is the conduction, conduction pathway for what? Sperm, right? Ductus deferens is right here. You can see ductus deferens is right here. It is surrounded by what? It is surrounded by same thing, pampiniformis plexus, right? Pampiniformis plexus, these are surrounded by pampiniformis plexus, as we discussed right above. So this was about what? Artery and vein. Now let us go to what? Nerves. If you just focus right here, this is small nerve, right? This is what? Genital branch of genitofemoral nerve. What I'm saying is genital branch of what? Genitofemoral nerve. Now what is important? It is important for cremasteric fascia. Now what is this cremasteric fascia? Cremasteric fascia, it is testicular elevation in scrotum. Testicular elevation in scrotum. So this was what? Testicular elevation in in what? In scrotum. Now talking about, after this genital branch of genitofemoral nerve, we will move toward what? Ilio-inguinal nerve. Now ilio-inguinal nerve, it is what? It is outside spermatic cord. It is outside spermatic cord, right? But it is outside spermatic cord, but it is inside what? Inguinal canal. That's all. So other thing remaining in this topic is, okay, that's all. So this was about what? This was about different boundaries of inguinal canal, its course. Okay, that's all.